Hello, I'm Dr. Arlen Ford, the chairman and founder of Activator Methods International. We want to welcome you today to our podcast, Activate Your Practice. And Activator is starting something new. After the first of the year in 2025, we're going to have a group of speakers, and we'll have a speakers bureau for anybody that needs a speaker for a state association, some kind of a meeting. They can call our headquarters, and we'll put it on our website. And so the good thing about it is Activator is going to sponsor this, so it costs the state associations nothing. And we are very happy to do this because we know things are changing day by day, and we want to keep everybody up to date on what's going on in the world of chiropractic. Now, today, I'm very happy to introduce to you one of our new people that's on our speaker bureau, Dr. Stacy Neal. I got to know Stacy when she was a student at Northwestern, and then she went in with Dr. Kathy Bloom, who was a clinical advisory member of Activator, and so Stacy's got a variety of things we'll talk about here today, but she is really into Activator for sure, and also helping students. That's one of her big things. She's just a really great instructor. So, hi, how are you doing today, Stacy?
Thank you for that introduction, sir. I'm doing great. Thank you for asking. How are you?
Well, let's start a little bit. I happen to know you, so I know all this about you, but I want everybody to know how you got into chiropractic. And so, you had another career, didn't you, before chiropractic?
Oh, I did. Yes, I did.
And what was
Yep, I am
tell
a,
us
I'm
about that?
so I'm actually a retired senior special agent with the United States Department of Homeland Security Investigations. So I used to conduct criminal investigations of crimes that were committed against the United States, primarily human trafficking, narcotics investigations, financial investigations, and child pornography.
And tell me, how did you get from that kind of a background into chiropractic?
Well, I decided to become a chiropractor after sustaining a work-related injury, actually. I was injured while at the federal law enforcement training facility, which is in Glencoe, Georgia, and during a training exercise, actually. And the injury led to 11 surgeries in 4 years and included fusions, an implanted spinal cord stimulator, years of recovery, and then ultimately disability retirement. I was 41 years old at the time and had served my entire life in some form of public service. But it was my workers' compensation chiropractor actually who had convinced me that I could walk again without the aid of a walker or a cane. And he would say things like, "Oh, hey, go leave your cane at the door. Go leave your cane at the door." And before you knew it, I left that darn cane at the door. And they called me and said, "Hey, come pick up your cane." It was Dr. Hasted, actually, that was his name. And I believe he still practices in Edina, Minnesota. But he reminded me that I still had the ability to give something back to my community. He had asked me, "What are you going to do going forward? You still have a lot that you can offer." And I said, "Well, I love what you do. What do you think? Do you think I could be a chiropractor?" And he said, "Well, I have faith in you. Go apply." And I did. And I've never looked back. I truly believe it's my calling.
Now, are you applying some of the skills you learned in your other job-related industry to chiropractic?
Oh my gosh, I am. I think the biggest thing is being an investigator. So for me, my entire life has been in some form of investigations. So I have my Bachelor of Science in Criminal Justice and Criminology, my Master of Science in Criminal Justice with an emphasis in forensics. I was a medical legal death investigator, a firefighter. So my past life was all in investigations. So to be able to take that investigations and build upon it and use it to help patients, I think is that's my true passion. I am a dietocnician at heart, so that's what I love.
A dia what? A dia.
Di-
I didn't get that word. What did you?
Dietocnician.
A diet. A diet technician. Okay. Um, Let me ask you this: if you were to describe yourself in 4 words, what would they be and why?
If I could describe myself in 4 words, it would be Christian, wife, nurturer, and chiropractor. Christian defines me. I believe it is having a heart that is willing to accept God's gift of grace and salvation through faith. Being a wife means that I'm living my life where I'm woven together with my husband. So we have shared dreams, goals, and aspirations. But a nurturer, that offers food, shelter, praise, training. And that's really my bread and butter. I love my children, my grandchildren, my nieces and nephews, and all of my bonus kids too. I love to feed them, dote on them whenever I get a chance. But last but not least, I'm a chiropractor. I'm a clinician who focuses on the body's ability to help heal itself. I take my Hippocratic oath seriously and dutifully serve my patients to the best of my ability, always.
What aspect in chiropractic do you find the most challenging?
The aspect, I think the one that I find most challenging is insurance for sure. Working with insurance companies is difficult, but primarily with the Centers of Medicare and Medicaid Services, I think. I'm thankful for our staff who help keep us informed on the latest requirements, but I would like to see chiropractors treated the same or with the same amount of respect, at least, as other professionals in the healthcare industry. I know our goals are the same, or at least they should be: first, do no harm and serve with rigor. So I think if all of our goals are the same, then there should be some semblance across the board.
Tell me about a time that you disagreed with another clinician.
Never disagreed specifically with a clinician, but I do find it challenging when another healthcare provider does not agree with chiropractic, and I put that in quotations, but or when they tell a patient to avoid chiropractic when they're in their care. I did have a case where just recently actually where a patient came into the clinic. He was like flexed forward all the way at 90 degrees, could not stand. Um, and I was able to treat him, get him to at least stand up a little bit, get him to be able to walk around the clinic a little bit more with a little more ease. But I did tell him if he worsens, he needed to go to the ER. And my recommendation was that he get an MRI so that we can see what was going on. He had laid on a foam roller on his back on the floor and tried to give himself some cavitation and couldn't get up off the floor after that. When he left my clinic, he went home, and then he felt like, oh my gosh, I'm worsening. I literally I cannot sleep. So he drove himself to the ER. When he got to the ER, they refused to do an MRI, and they told him, well, we don't need an MRI to see a hot disc. So they put him on pain medication and some muscle relaxants. He didn't get better. The next morning, he went to urgent care and he was like, well, I'm just going to go to a different place because the ER didn't give me an MRI. He tells urgent care, I need an MRI. I need to find out what's going on with my back. And urgent care says, well, you have medical assistance, and so we're not going to order an MRI for you. Go home and continue to take your pain medicine and maybe don't go to the chiropractor. Well, he came back in to see me the following day. I ordered him an MRI, and it come to find out he had, multi-level discs were, bulging, and he had osteoarthritis and some spurring. You can tell that he had some nerve impingement. But the calm that washed over that man's face when he learned that there wasn't anything that was killing him. He wasn't dying. He could get better. It was amazing to see that happen. And so, no, nothing grim, no diagnosis was grim in this case, but it helped guide the patient's care. So I feel like we still need to do better with interpersonal relationships. In this case, you know, it it wasn't bad, but helping him made a difference. There was another time with blood clots. I mean, it's just absolutely absurd to see that, there's not a lot of love for chiropractors, it seems sometimes.
Well, you have to be around like me for over 50 years to see that for sure. And it
Yeah,
has changed dramatically from when I first started. But most of that, somebody asked me one day, why is that we're accepted more today? Well, the answer to that is really quite simple. We have data. And when you have data and you have papers like
that's true.
Activator has really been fortunate in the last 4 papers that we've published. They've been published in scientific report, which is a branch of nature. And so when you get to the
Oh
nature
yeah.
level, that's about as high as you can get. But we
Right.
we had a call from Ohio State University the other day that they wanted us to participate in a research program because they saw that we had been published in Nature. And so I think
Oh wow.
that's what's helped us gain credibility is being published in the scientific journals. How did you get involved with Activator?
Oh, well, how I got involved, actually, I did my first in with the trimesters there are 10 with Northwestern. I'm not sure if it's the same across the board, but with T1 originally starting chiropractic school, I met up with a couple of the professors who said, um, that knowing I had an injury that I might be interested in Activator. I didn't know what it was at all. I had never heard of it. I had never been adjusted by Activator. And then I came and seen Dr. Kathy Bloom's clinic, and I fell in love. I was like, what is this tool? How is this working? I just couldn't even fathom that this could work. And so I really started to investigate it, and I kind of became a little thorn in Dr. Kathy's side. I would follow her around like a puppy. I came T1, T3, I probably came T4, I came back at T6, and then I wanted to work for her and become an intern. And that was really helpful because I stuck around. I was able to be here for T8, 9, and 10, and then she asked me if I wanted to work with her. I said, "Yes, of course I do."
And you're
So
and,
that's how I came to Activator.
and you started from that with Kathy to teaching a class at Northwestern today. Is that correct?
Yes, that's correct. I currently am an adjunct professor with Northwestern, and I'm loving it, absolutely loving it. Tomorrow's our final, so it's going to be exciting.
Well, that's a quite a journey, and I think you're also slated to teach for the I guess you call it the homecoming, Northwestern's homecoming in February. Is that correct?
Yes, that's correct. Yeah. Yeah, they asked if I could put something together that would kind of highlight what an activator clinic looks like. So it'll be nice to show them that we are the same in in our diagnostication, to kind of diagnose a patient is the same. It's just the protocol is different. So
Exactly.
it'll be nice to be able to highlight that.
Yeah.
Yeah.
Well, we're looking forward to having you do that. And, I just want to say again here's a story of somebody that came up through a different profession completely and then was unable to continue, switched professions, and became very successful. And by the way, her students love her at Northwestern. I've talked to a couple of them, and they're so excited
Thank you.
to have her teaching now. And we're really looking forward to it. So just remember, Activator Methods has a new speaking bureau, and one of the instructors that you can tap is Dr. Stacy Neal from Minnesota. So, Stacy,
Yes.
thank you for your time today, and we're looking forward to the future.
Well, thank you. Thank you for having me, sir.